And so I'm going to end there and introduce Jacob, or Kobe, as his friends call him, Ablin. This is an article that I did with Kobe. Kobe came and spent a couple months with us a long time ago. He did a mini sabbatical with us. And this is a paper where he, for one of the first times that I was aware of, started to look at the health effects in the general population. These were as civilians, and it turns out that, again, as many of you are aware, Israel is very close to Gaza. There are parts of Israel that have been repeatedly under mortar attacks and things like that. And this article was really just pointing out that in two different towns in Israel, one of which that was closer to Gaza and was more frequently attacked, there were different rates of fibromyalgia, chronic widespread pain, again, what we would now call nociplastic pain. So Kobe is going to now continue to talk about the health effects of war. And again, he is from Tel Aviv University in Israel. Kobe?
Okay. Good morning, everybody. I'd like to start out by thanking the organizers, and Dan particularly. It's a great experience to be here. I haven't been here for 16 years, so it's a real deja vu for me. And I'm going to be talking to you about some additional aspects of war and pain. It's, of course, very challenging to talk after Dan, but I'll do my best. War has obviously been around for a very long time, thousands of years. Human history is basically the history of military conflicts. And it seems as if we've really gotten better, mostly in finding better ways of killing each other and possibly also of brainwashing each other. We haven't gotten much better on other aspects. And war obviously has a huge direct cost. Everybody knows that war causes people to get killed, and war causes a huge economic cost and also leaves many people devastated for life. Due to physical trauma and to rehabilitation costs and psychiatric comorbidity and so on and so on. But today we are here to speak about sort of hidden aspect of this cost, the aspect of chronic pain, which is possibly less self-evident than other aspects of the issue. So, just sort of trying to estimate the costs of war. I mean, obviously we have the costs of all the ammunitions we have to buy and the devastation to structures, infrastructures, more indirect costs such as famine, dealing with refugees and so on, huge costs altogether. And some smart people have tried to figure out how much it's actually costing us. It's costing us billions. Some say like $14 trillion a year on a global level. It's a huge amount of money, which could obviously be utilized for much better purposes. And we do get some benefits. We get some good movies and some good ballads out of it, but that's about all we get. I mean, there are some positive spin-offs as far as research is concerned. Obviously, military technology does sometimes lead to positive spin-offs like developing nuclear medicine and so on. But if we really go back over time, we see that for time immemorial, various people have sort of considered war as kind of a high human achievement, spoken about the art of war, or of how war can be utilized for achieving our political goals, not to mention actually considering it kind of noble expression of human achievement. So, somebody's obviously viewing war as a positive thing. Some people stand to profit from war, but we are here on the other side of the equation. And I'm going to be looking at different points of view of the effects of war on humans. One point of view is the way it actually affects soldiers in particular, people deployed to military conflict, the way it affects individuals, civilians, family members, loved ones, and society as a whole. And there is, of course, a huge amount of research coming out lately about these issues, a lot of it regarding the conflict in Ukraine, which I'm sure we're going to be hearing about more later. And then just, it's talking about chronic pain, which Dan, of course, sort of set the ground for. We do consider chronic pain, we used to talk more about fibromyalgia, now more about nociplastic pain, as a combination of a situation which develops when you have the genetic predisposition to develop it, and you're exposed to various triggers. So the triggers can be physical trauma, mental stressful trauma, infection, other triggers as well. and also things like loss and bereavement, which we're also going to be hearing about a little later. So you might ask, some parts of the puzzle, the way war factors into this appear to be self-evident. Obviously, in war, individuals are put under a lot of stress. They experience both physical and emotional trauma, but also indirect effects such as malnutrition, infectious diseases, exposure, vaccines, which may or may not play a role. This is debatable. And of course, the overlap with the clinical and epidemiological overlap with PTSD, which at this point has been well recognized. I'd just like to mention the interesting effect of loss and traumatic loss or bereavement on this issue. We will be hearing more about this later, but I think we as clinicians over years have sort of studied the whole issue of dealing with loss or dealing with bereavement on quite a superficial level. In med school, we were taught about the Kubler-Ross model. People are supposed to go through loss in a sort of sequential way. You have a few stages, and then you're done, you're through it. And this is a very simplistic way of looking at loss. Nowadays, there are more modern or advanced models of dealing with loss, so-called two-track models, where you actually continue your relationship with the deceased individual while returning to a level of function. And these are very interesting conceptual developments, which we really don't know enough about the neurobiology of this, how the brain reacts to loss and bereavement. There is some research coming out over the last few years that I think not yet actually pointing at the way in which the brain changes in loss and bereavement and how this interacts with chronic pain. I think this is a sort of very interesting interdisciplinary aspect which we might want to look at in the future. So I mentioned PTSD. PTSD, we know now that from a large number of studies that PTSD overlaps with chronic pain, that many PTSD patients will fulfill criteria for fibromyalgia and vice versa. So that seems self-evident. And I'm going to be just very, very briefly touching on a few examples of the way in which war can affect individuals. One model, I could say, is the Holocaust survivors. Dan already mentioned Soldier's Heart and the way it sort of developed from one war to the next. I won't be talking about Gulf War because you heard about that. And I will be talking about the effects of terror, or so-called asymmetrical warfare, including the study which Dan mentioned. So, start with Holocaust survivors. Holocaust survivors are, as is pointed out here, arguably the most extreme model of human exposure to war-related trauma. These are individuals who went through a combination of traumatic exposures, incarceration, concentration camps, starvation, torture, traumatic loss, humiliation, constant threat of death, and very importantly, this is a very lengthy exposure. I mean, this is something that lasted for years and years, as well as being a sort of existential crisis for many people involved. And over the years, going back to the 50s and 60s, there started to sort of research what happened to Holocaust survivors on a medical level, what medical outcomes they had, starting mainly with the psychiatric outcomes such as depression, anxiety. Gradually, as the concept of PTSD evolved, it started being applied to the Holocaust survivors. A lot of this research is done by a researcher called Rachel Yehuda, who, interestingly, also investigated the epigenetics and transgenerational consequences of this kind of trauma. So there were a number of studies looking at chronic pain, particularly in Holocaust survivors. This was one example of a study showing a significantly higher level of pain among these individuals. But on the other hand, there was a very interesting study called the so-called Jerusalem longitudinal study, where they actually took individuals who were born in 1920, 1921, and longitudinally, and were in the Holocaust, and followed these patients from the age of 70 to the age of 77, looking at a whole bunch of physical outcomes. And the interesting thing is that they really did not have any effect on physical health and mortality. I mean, they did not have increased levels of either morbidity, mortality, or in fact of joint pain. And they were actually able to go back to these patients in their 80s and 90s and even late 90s. And these patients really fared pretty well. So this really appeared to be a very highly resilient group of individuals who had both survived the Holocaust and lived into their 90s. And this goes back to what we heard before from Marty about the the effects of resilience, the way in which it's really complicated, the way this kind of exposure can affect people. This was a study I did together with Dan Muskila a few years ago, in which we took a bunch of Holocaust survivors and were able to show a high percentage of fibromyalgia criteria among these individuals. So it really is variable. And this again going back to the transgenerational transmission of trauma among Holocaust survivors. So we already heard about the irritable heart, the so-called Da Costa syndrome, going back to the soldiers in the Civil War and other conflicts in the 19th century, with this combination of symptoms such as palpitations, fatigue, chest pain, sweating, orthostatic intolerance, presumed to be due to heart failure. And these are patients who today would probably be called either chronic fatigue or postural orthostatic tachycardia syndrome or other nociplastic syndromes. And then again, as Dan mentioned, going through the various military conflicts, we see in the First World War the so-called shell shock soldiers. And very similar to the Gulf War, again, you have this combination of explanations. Maybe it's trauma to the brain, maybe it's exposure to poisonous gas, maybe it's somatoform disorder. Some of these patients were accused of just being cowards and punished for it. Yeah. And then moving on into World War II and other terms and so on. I want to just briefly focus on the effects of so-called asymmetrical warfare or terrorism. And it's really surprising how difficult it is to define terrorism today. We generally consider terrorism to be a situation where civilians are targeted by violent interventions by sort of non-state organizations. And there are various terms in the popular literature: asymmetrical warfare, fourth generational warfare, but all usually targeting civilians. And some of the interesting implications of this are the random nature of the exposure. I mean, civilians are targeted by terrorism and not soldiers who are deployed into combat. You never know when it's coming. You never know when a missile is coming or a drone is coming. You never know when you might encounter a terrorist, a suicide bomber, and so on. And this is part of the very traumatic effects of exposure to terrorism. And again, interestingly, not all terrorism events are the same. So this is a famous study which was done after 9/11, looking at fibromyalgia symptoms before and after the 9/11 attacks. This was a survey done in the New York metropolitan area where fibromyalgia patients were contacted regarding their symptoms and were contacted again after the 9/11. And the interesting finding was that fibromyalgia-like symptoms did not increase significantly after the 9/11 attacks, despite this hugely traumatic and stressful event. So one of the explanations for this, of course, is, again, that personally relevant stressors are much more important than things that happen that you see over the media. And the people who are not directly involved by the attack, or not directly injured, or not directly bereaved, did not appear to get much worse as far as their pain symptoms were concerned. Another aspect might be the duration of stress, because this was a relatively short exposure to stress. And of course, resilience probably played a role, and possibly the sort of general togetherness around the 9/11 attacks may have had a protective effect. And then, going back to the study which Dan mentioned before, where we were able to look at what happens when you have a more lengthy exposure and a more personal exposure to stress. So this was this article we did back in 2008 about Sderot and Ofakim. Sderot and Ofakim, these two towns in southern Israel. One of them is right on the border of the Gaza Strip. The other is 24 kilometers away from the Gaza Strip. Doesn't sound like much, but in this period in history, it made a big difference because Sderot had already been for years under missile attack regularly. Individuals had, as it says here, 10 to 15 seconds of warning to run for cover. And Ofakim at that time had not yet been targeted. This has changed. Right here you can see Sderot and Ofakim, and this is the Gaza Strip. So what we did is we did a telephone-based survey. We contacted a large number of individuals in Sderot, in Ofakim, and passed a questionnaire regarding pain, somatic symptoms, anxiety, depression, PTSD. As you can see here, widespread pain was significantly more common among individuals in Sderot compared to Ofakim, as well as other symptoms such as IBS-like symptoms, chronic fatigue, PTSD-like symptoms, and so on. So we really were able to identify a sort of fibromyalgia-like cluster of symptoms among individuals in Sderot who had been directly exposed to stress over the years before this research. And then, of course, we come to October 7th, a very unique model of exposure, a combination of circumstances which made it very extreme. The surprise of attack, the huge number of casualties, the exposure to direct acts of cruelty. We heard before that natural disasters tend to be less harmful for humans relative to man-made disasters. So there seems to be something about exposure to man-made damage or cruelty, which is particularly damaging to our brains. And here we had all these specific aspects, as you can see, sexual violence, live streamed, and social media, and so on. The Israeli population experienced this as a very shocking event, sort of reactivation of previous trauma, such as the Yom Kippur War, reminiscent of Holocaust memories, and of course, individuals who had previously been exposed to trauma had a reactivation of trauma as well. An event like this has various effects. I mean, we have different circles of people who are influenced by it. You have, of course, the first circle of the survivors and the victims, the second circle of the families, families of hostages, families of victims. There were specific areas such as delayed grief, a condition where people didn't know if their loved ones were alive or dead for many weeks after the attacks. The physical destruction of houses, destructions of communities, destruction of community support, large number of individuals who have been displaced. And then, of course, the effect on first responders, police officers, soldiers, hospital teams, the so-called Zaka volunteers. These are these ultra-Orthodox volunteers who dealt with the casualties, and basically just everybody else, everybody who watched the news or was exposed on social media. Just to stress one specific or unique aspect is the aspect of the hostages, a large number of hostages still being held at this point, creating a situation we call ambiguous loss. It's a situation where you really can't reach any kind of closure when you don't know if the people are alive or not and if they're ever going to come back. And there has been research coming out already since the beginning of this conflict showing huge increases in symptoms such as PTSD, depression, anxiety in the whole Israeli population since the beginning of this attack. I'd like to just very briefly show you an example, a clinical vignette, or 52-year-old patient, a woman who comes in complaining of widespread musculoskeletal pain, several years, significantly worse lately. She has a medical history of a mesothelioma 2 decades ago, which was treated and cured. She's had some episodes of ileus with abdominal pain, previously diagnosed with endometriosis, some chronic abdominal pain regarding that. And currently she's reporting both widespread pain, fatigue, sleep disturbances, difficulties with concentration. And she tells me that her 19-year-old daughter was killed on October 7th. And of course, this patient has fibromyalgia. That's a no-brainer. Just some points to notice. The previous medical history, previous exposures, previous abdominal pain as an issue, all possibly predisposing. And then above this, the traumatic loss, really very obviously leading to the direct exacerbation of symptoms and the generalization of pain. And this patient was diagnosed with fibromyalgia and depression. The patient, a highly qualified professional, was unable to continue work at this point. She's really debilitated. She's on amitriptyline. It's not doing very much. She's doing psychotherapy. Possibly we'll see medical cannabis, but she's a mess. And these are unpublished results of a study of Valerial showing how fibromyalgia patients as well, who were contacted after the war, many of them had actually gotten worse, more pain, less exercise, and so on. Adverse mental, physical outcomes since the beginning of the war. So yeah, in conclusion, war and military conflict really have very huge, diverse effects on the development of chronic pain conditions. It's a whole puzzle of physical trauma, emotional stress, loss, bereavement, exposure, fear, anxiety, depression, all part of this matrix. There is obviously a clinical and pathogenetic overlap with conditions such as PTSD. It has huge consequences both on soldiers and on civilians and on society in whole. And I really believe that chronic pain should be considered one of the lasting and invisible prices of war. Thank you very much.